Now, what should that woman do to ensure, firstly, to know whether she will also get the cancer or not? And if she realizes that she is also prone to this cancer, vulnerable to this cancer, what should she do?
Very good question. So what we do is, first what we call this is an index case. You should remember about this word index. The patient who is suffering from the cancer is called index case. What we do is we check the mutation in the index case first. We don't test the children's. It is a waste. If
Oh,
the index case is having the mutation, then we call it as a hereditary cancer. Then we tell to children to undergo the same gene testing to see if she is also mutated or not mutated. So first we test the index case. If it is positive for mutation, we test the children's for the mutations. So the thing what we do is we do the mutation testing in first the patient, then the attenders.
oh, okay, okay. Now, let's say in the patients, obviously, we will realize that she's has that cancer, and we will test the children, and we also realize it that children are also vulnerable to this cancer. They carry the same genes. What should they do?
Correct. Very good question. You're talking scientific. I appreciate your knowledge. You're talking like maybe MBBS doctor. So what we have to do is, if I see a normal person is having the mutation, this becomes a high risk for cancer. The patient is having high risk, not patient, I will call it as a normal person is at a high risk for developing cancer. We cannot prevent the cancer in them. So what we do is we call it as screening. We screen
Okay.
the person at regular interval to see if they are developing cancer. The dictum here is to detect the cancer in early stage. If I detect the cancer in stage 1, the cure chance is more than 95%. This drops to 0% if you are in stage 4. So what I do, if there is a mutation in that person, I do regular screening. To give you example, the regular mammogram, what we do for breast cancer screening, we start at 40 years. But if somebody is having mutation, we start at the age of 25 years. I
Okay.
cannot prevent cancer in that person, but I can screen, I can detect it early, I can treat it early, and I can cure the cancer.